Founded in 1997, Sirtex researches and develops effective treatments for liver cancer using novel small particle technology. The procedure is known as Selective Internal Radiation Therapy, or SIRT. The procedure takes advantage of the fact that the blood supply of the normal liver is approximately 80% from the portal vein and 20% from the hepatic artery, whereas tumor derives all its blood supply from the hepatic artery. By using the hepatic artery, tumors can be selectively irradiated with much less effect on the normal tissue. The radiation is delivered by small biocompatible microspheres called SIR spheres that are about 1/3 the width of a human hair. They contain beta radiation emitting yttrium-90. The spheres are injected into the hepatic artery where they travel in the bloodstream to the tumor. It's not necessary to know the number or location of the tumors, as the SIR spheres will target them regardless of where they are. They lodge in the small vessels of the tumor where they selectively deliver high doses of radiation to the tumor and the neovascular blood supply of the tumor. The PET scan on the left shows multiple colorectal metastases on the right and left lobes of the liver. The PET scan on the right is from the same patient 6 weeks after the right lobe only was treated with a single injection of SIR spheres into the right hepatic artery. The post-treatment scan shows disappearance of all tumor in the right lobe, but continued presence of the tumor in the left lobe as that side has not yet been treated. The disease in the left lobe then disappeared after a second injection into the left lobe. These pictures compare the changes seen on PET with CT scans after SIRT. On the left is a patient with PET and CT scans before treatment. On the right are the PET and CT scans of the same patient 4 weeks after treatment with SIR spheres. You can see that on PET scanning the disease has largely disappeared, but on CT scans there are still large tumor masses, although they now appear largely necrotic. The message is that PET scans show changes much earlier than CT scans and are a better indicator for response. The 4 main sections of the video have been designed to demonstrate correct procedures when working with SIR spheres. Before preparing the dose, please ensure that the room meets local requirements for working with a radioactive treatment. It's recommended that 2 pairs of gloves be worn when preparing the SIR spheres dose. SIR spheres will be shipped in an approved container. The SIR spheres shipping vial will be in a yellow lead pot to provide protection from radiation. Remove the lead pot from the shipping container and place it behind the L-block and acrylic shield. Check the label on the lead pot and vial to verify and confirm the calibration date is correct. Use tongs to remove the SIR spheres shipping vial and invert the spheres until they are fully suspended. Measure the activity of the SIR spheres by placing the shipping vial into a dose calibrator and press the button with the yttrium-90 setting. At the time of calibration, the activity should read within plus or minus 10% of the supplied dose. This is always approximately 5 milliliters. Record the reading. Please refer to the SIR spheres training manual for more information on calibration.
So we want 3 mLs volume. So before you draw any up, you want to shake up the vial again.
Roll back the aluminum cap using a remote handling tool.
You do not want to do that with your fingers because it's highly radioactive. We like to roll it back with hemostats.
Wipe the septum with an alcohol swab.
You want to grab the alcohol wipe with the hemostat so you're not touching the vial.
Dispose of the alcohol swab in the appropriate radioactive materials waste container. Remove the empty V-vial from the sterile pouch provided by Sirtex and place it into the acrylic holder. Roll back the aluminum cap. To further ensure sterility, wipe the septum with an alcohol swab. Open a 25 gauge 5/8 inch needle.
So I'm going to open our cotton swab. We're going to put a little bit of cotton in the end of the open needle. That way when you're shaking the vial, nothing can come back out of the vial. And I'm going to break the end off of it. And that leaves the cotton in there.
This is also referred to as a venting needle. When inserting the venting needle, make sure it is close to the outer edge of the bullseye of the septum. Place a 5 milliliter syringe into an acrylic holder. This will be used to withdraw the required dose. Make sure the cap is securely screwed back on. To withdraw the required dose of Cerspheres, insert the shielded aspirating needle into the shipping vial. Prior to drawing the dose, resuspend the Cerspheres by drawing the syringe plunger up and down several times. The dose then needs to be drawn up quickly so the Cerspheres don't have time to resettle. Stabilize the shipping vial using a remote handling device such as tweezers or the needle cap. It's important to draw some air up into the syringe. This will force any of the Cerspheres trapped in the tip of the needle to be drawn fully into the syringe. Once complete, cap the needle. To measure the residual activity of the Cerspheres, invert the shipping vial and place it into the calibrator. Measuring the activity level is important in determining if the correct dose has been drawn up into the syringe. Record the reading and subtract the residual dose from the initial dose.
So we write down the number of the activity remaining in the vial and subtract the 2, and that'll give us the amount.
Insert a venting needle into the empty V vial before dispensing the Cerspheres dose. It's recommended to mark the aluminum seal of the V vial so as not to use the same puncture holes during delivery setup. Make sure the needle is inserted on the outer edge of the bullseye opposite to the venting needle, lining it up with the red mark on this vial, and inject slowly. Dispense the dose carefully into the empty V vial. During this process, some air may have to be drawn back up into the syringe for the dose to be completely dispensed. When removing the needle, it's important to stabilize the V vial with tongs, or in this case, a needle cap.
I like to use the needle cap to help remove the needle. Draw a little air back just prior to removing it from the septum, and then recap.
Water for injection may have to be added to bring the V vial up to 2/3, which will promote a homogeneous suspension and facilitate delivery. Use a remote handling tool to remove the venting needle. Dispose of the venting needle as radioactive waste. Wipe the septum of the V vial. When complete, dispose of the alcohol swab. Be careful to not wipe the marks off of the septum. Screw the cap back onto the acrylic holder and place the plug on top. Each treatment of Cerspheres comes with its own delivery set. When removing the contents from the set, it is essential that all needle caps remain intact to ensure sterility. Before connecting the delivery set, check that all lure lock connections on the 4 delivery lines are tight. The flag on each line is color-coded and given a letter to ensure proper placement in the delivery box. To assemble the delivery set, start by making sure the control knob is pulled all the way back. Insert line D into the corresponding hole and drape the needle over the side of the box so that the needle is outside. For lines A, B, and C to be inserted, line B must be inserted first. Once B is in place, engage the 3-way stopcock in its holder at the back of the box. Line A can now be placed through its hole and line C draped over the side of the box. With the lines in their respective places, engage the control knob. This is done by firmly seating it against the handle of the stopcock. The control knob and handle should now only be able to turn 90 degrees. Before delivery can occur, all lines must be primed with water for injection. In priming all the tubing, it is essential to remove all air bubbles. Attach a 20 milliliter syringe to line D on the outside of the box. Loosen or remove the needle cap and slowly push through some water. Once a bit of water has dripped out of the needle, priming is complete and the needle cap repositioned. Attach another syringe with sterile water to line B. The handle of the 3-way stopcock must be in the 3 o'clock position before beginning to prime. Again, only a bit of water needs to drip out in order for the line to be primed. Before priming line C, make sure to partially disengage the control knob by pulling it back past the notch. This will allow for a 180-degree rotation of the handle of the 3-way stopcock. To prime line C, the handle of the 3-way stopcock needs to be at the 12 o'clock position for water to flow through the stopcock and into line C. Before continuing with the rest of the setup, it is vital to ensure that the control knob is back into its original position and that the 3-way stopcock is fully re-engaged. Place the acrylic shield containing the SurSpheres dose into the retaining ring in the delivery box. Using a remote handling tool, wipe the septum with an alcohol swab. Dispose of swab as radioactive waste. To attach the needles and lines to the V-vial, take the shorter needle attached to line D. This should be placed 90 degrees from the marks made on the vial during dose preparation. Insert the needle until the hub is firmly seated and the needle is at the bottom of the vial. Next, pierce the long needle attached to line C through the septum. Ensure it is not on or within 1 millimeter of the first needle. The needle needs to be inserted 10 millimeters below the fluid level because during implantation the spheres are decanted from the top. With the apparatus setup complete, line A will be attached to the catheter. Before delivering the spheres, it's important to know that when the handle of the 3-way stopcock is at 6 o'clock, it is off to contrast. When at 3 o'clock, it is off to dose. To begin delivery, ensure that the handle is off to contrast. Using water for injection attached to line D, pulse an aliquot, about 4 cc's, through. The spheres will swirl into suspension and travel through line A and into the catheter. Turn the control knob so the handle is at the 3 o'clock position and is therefore off to dose. Using sterile water attached to line B, flush the catheter line. To check the flow of the spheres, use contrast. Switch the water syringe on line B to a contrast syringe. You may prefer to attach an additional 3-way stopcock to line B to prevent the constant switching of syringes on this line. Once the contrast run is complete, flush lines with water for injection attached to line B. Ensure that the angiography suite is properly set up before implantation.
What we start doing here at this point, the patient is outside. What we do is we start setting up our angio tray.
All staff involved should be double-gloved and double-booted. Cover the angio prep table to ensure sterility while the patient enters the room. Shield areas to avoid possible contamination. There should be a drape on the floor between the delivery box and the patient. This will assist with cleanup should a spill occur and prevent the microspheres from traveling onto the floor. Make sure a sterile towel is placed under the delivery box. The following is an actual procedure performed by Dr. Nutting and his team at the Good Samaritan Hospital in Phoenix, Arizona. Before preparing the delivery box for setup, place it on the right side of the patient. The delivery box should be positioned at the same or higher level than the patient. Open the delivery set and place the lines in the corresponding slots in the delivery box.
So we're just priming the lines with water.
Make sure all lines are primed with sterile water.
He's now placing the outflow needle in the vial. The outflow needle stays above the actual beads themselves. So here he's placing the inflow needle just to the level of the beads. Here we're putting a three-way stopcock on line B. That allows us to inject water as well as contrast material during the procedure. It's important to perform an intra-procedural angiogram to make sure that we have forward flow and don't have stasis. Okay, at this point what we're going to do is we're going to turn off to the vial or the dose administration. We're going to slowly inject some water into the system just to make sure that we have patency. Okay, this is the point where we connect the microcatheter, which is inside the patient, to the SurSphere administration set. So this is the connection between the administration set and the microcatheter inside the patient. We want to make sure that's a secure connection. What we're going to do now is the stopcock is turned off to the SurSphere beads. We're now going to infuse a small amount of water through the line. There's a series of one-way valves inside of the administration set to prevent any backflow. At this point, we're going to pulse the beads into suspension by injecting water into the inflow line. This is going to load the outflow and delivery catheter with the microspheres. We're now going to turn the administration set off to the beads. The microspheres are now within the line, the outflow line of the delivery system, going into the microcatheter and into the patient's hepatic artery. With the three-way stopcock closed to the spheres, we're now going to inject some water and push those beads that are already loaded in the catheter. After approximately 4 cc's of water, the beads have now cleared the exit system and the microcatheter. We're going to perform an angiogram by turning off the three-way stopcock to the water and injecting some contrast material. It takes about 3 cc's of contrast to load the system. We'll perform an angiogram to demonstrate forward flow of contrast material. Sir, stop breathing right there. You can breathe normally. We're now going to clear the contrast that we just injected. So we turn off to the contrast material, and we now inject water through the microcatheter and outflow line. Here we're turning the knob so that we can inject more beads. These beads are going to be pulsed into suspension. We're now going to turn the knob off to the beads and clear the catheter with some sterile water. So again, we're loading the catheter with contrast so we can perform our angiogram. So after every contrast injection, we then clear the line with water. So what we're going to do is advance the delivery needle deep within the suspension. So it's right at the very tip. And then what we're going to do is disconnect the water. And we're going to introduce air into the system. We turn off to our purging line. You can see there's the air fluid level is going through the inflow line. The air is going to bubble into the vial, creating an air fluid level. That air fluid level is then going to push the remainder of the beads into the outflow needle and into the microcatheter. Until we get to the point where we get air in the outflow needle, at which point we turn the three-way stopcock off to the patient. See right here.
Carefully remove the catheter from the patient because it may contain a small amount of radiation.
It's important to grab the catheter at the tip so that you don't have a small drop of yttrium-90.
Place the catheter into a polypropylene container.
This is all they're left with after the procedure, is a very tiny incision.
With delivery complete, the patient will be cleaned up before being moved to the recovery room. As Cerspheres is radioactive, it is subject to safety regulations. It is imperative that pregnant women not work with this treatment at any stage of the preparation, delivery, or post-procedure care. Please note that the information provided here is a general guide only, and the exact requirements for each jurisdiction must be determined before introducing Cerspheres into the facility. Dose preparation is undertaken in a registered facility. Ideally, an L-block and acrylic shield should be used when preparing the Cerspheres dose. The shipping vial should remain in the lead pot at all times except when the spheres need to be resuspended, or when they are being transferred to and from the dose calibrator. To maximize shielding, remove only part of the crimp seal on the shipping vial. The V-vial is to be placed in an acrylic holder before transferring the microspheres. As well, the shipping vial and the V-vial should be close together to minimize transfer distance. Once the dose is drawn into the syringe and the needle is clear of the slurry, a slight pullback on the plunger will reduce the chance of leakage from the tip of the needle. The patient dose in the acrylic holder should be stored in a designated storage area until it's time to deliver the dose to the implant suite. The dose should be kept in this holder during delivery. Prior to implantation, ensure that the suite is properly prepared and that receptacles are placed nearby. Please refer to the angiography suite preparation section for more information. In addition to standard attire, double gloving and double booting is recommended. After the procedure, the patient becomes the radiation source. This can make it difficult to survey in the room. However, the minimal penetration distance of the beta emissions in tissue means that patients pose a very small radiation risk to staff and other contacts. To be cautious, staff should always wear gloves to handle dressings. Once all post-procedure treatment has been provided, the patient is moved to a recovery room and the rest of the suite monitored. All staff should be checked, including soles of shoes, hands, and body before leaving the area.
Okay, the other foot. We check their hands, we check the front in case of any splashes, and we check their shoes. We survey everybody that leaves the room. It's best to use a room that you have controlled access to, just one entrance and exit.
All disposable items from the delivery set should be placed into a polypropylene container. Since the container includes possible radioactive materials, ensure that the cap is properly secured. Place this container into a benchtop beta shield for another layer of protection. The box can now be taken out of the room. Surgical equipment should also be monitored, and if contaminated, they should be cleaned in decon. Once equipment has been checked and cleared, it can be handled normally. The floor mat the delivery box was near should be surveyed in case any spills or leakage occurred. Once surveyed, it can be disposed of. As well, the garbage collected during the procedure should be surveyed as a precaution. This section contains a brief overview of patient aftercare. For further information, please refer to the Surtex training manual or contact Surtex.
In the post-procedural care, after the angiogram is completed, we use a closure device and send the patient up to a recovery area where they stay from 3 to 4 hours. The patients are then discharged to home the same day. While in the recovery area, we'll treat any nausea or pain that they have, but typically the patients are sent home on oral medications and do very well.
For patients in the acute setting after microsphere therapy, there can be stretching of the liver capsule due to radiation-related edema. This can often give the patient discomfort in the right upper quadrant, sometimes requiring pain medication such as Percocet or other narcotics. One solution that has been very effective both for the nausea symptoms and the pain is to use a short course of steroids.
When patients are moved to the recovery room, it's recommended that a physician or other qualified personnel be available for at least an hour to monitor and to answer any questions they may have.
The side effects that we've seen in this institution, in our personal experience, at the worst last about 3 to 4 days. Most of our patients, they have the feeling of just being tired, a really bad case of the flu for about a day or two, and then they all tend to get better.
Patients may also experience a low-grade fever in the first 10 days following the procedure. This can be managed with treatments prescribed by physicians.
3 or 4 days after the procedure is completed, they're going to feel tired, really tired. They won't want to get out of bed. This is where families are so important because they basically have to rouse the patient out of bed, make sure that they are well hydrated and have enough to eat and have enough nutrition. The most common reason for people to come back in the hospital after this therapy is dehydration. while we may not be curing them, we are certainly increasing their quality of life, and I hope increasing their survival.